In this video, I'm going to share with you some important information about the connection between vitamin D and fertility. My name is Dr. Shannon Vanderdolen. I'm a naturopathic doctor with a virtual practice focusing in women's health, fertility, and pregnancy care. And we know that vitamin D plays a really important role in all three of those pieces. We know that vitamin D plays a role in fertility for a couple of reasons. One is that we know that there are receptors for vitamin D on our ovaries and in our uterus. So vitamin D most certainly plays a role in these organs and in these systems. And two, that we do have a pretty good body of research looking at the connection between vitamin D in a couple of various situations. So one is we know that vitamin D status and having adequate vitamin D levels in your body is important for improved IVF outcomes. So when people have vitamin D deficiency, they're less likely to conceive through IVF, whereas if they have adequate vitamin D levels, they're more likely to get pregnant after an IVF cycle. We also know that there's research looking at two of the most common causes of infertility, those being PCOS or polycystic ovarian syndrome and endometriosis. And we know that vitamin D deficiency worsens both of those conditions. So we can take all of that information and make a pretty safe assumption that vitamin D is also important, or vitamin D status is also important when we are trying to conceive naturally on our own. So a lot of people will ask me, well, how can I make sure I'm getting enough vitamin D? Where do I get vitamin D from? How do I know how much to take? So the three sources of vitamin D available to us are one, from the sun. And that's going to be very variant based on where we live and the time of year. So I live in Canada, I'm in Ontario. We're really only going to get vitamin D from the sun in the summer months. The second place we can get vitamin D is from our food. So dairy in Canada is often fortified with vitamin D, and we also get it naturally occurring in a few foods, mushrooms being a very notable one. And the third place, or third source of vitamin D, is a supplement, a vitamin D supplement. So specifically with supplementation, I want to know what your levels are prior to recommending a supplement. This is a really important piece because though vitamin D is considered pretty safe to take as a supplement, you can overdose on it and you can push your levels to a toxic level. And I really don't know your vitamin D status just by looking at you. It's impossible to tell. We really do want to test and then treat your level of deficiency with the appropriate dose of vitamin D. We want to make sure that your blood levels of vitamin D are sitting somewhere in the range of 100 to 150 nanomoles per liter. That's the unit of measurement we use in Canada. If your vitamin D status is lower than that, we might want to increase your vitamin D dosage to push you into that level or into that range. And if your vitamin D status is sitting higher than that, we actually might want to ease up on your vitamin D supplementation, or depending on the time of year, we might actually have you discontinue your vitamin D supplement until maybe we get back into the winter season. If you have any questions about your vitamin D status, how to access a vitamin D test, please feel free to send me a DM. I'm more than happy to hear from you and help you navigate this testing piece.